Hi, I am Dr. Venkata, working as consultant pediatrician for the past 14 years. During the hot summer months, it is very important for all the parents, caretakers to be mindful of the heat and protect their children from heat illnesses such as heat exhaustion and heat stroke. Most of the times, they don't recognize the effects of the heat, and this can get them and their children into trouble with heat illness, which results from exposure to heat. For this, all should be aware of these conditions, the symptoms and signs, and how to prevent them. Heat exhaustion often occurs after a child has been traveling, exercising, or playing in the heat and becomes dehydrated from losing excessive fluids and salt from sweating. Symptoms and signs of heat exhaustion are an elevated body temperature, usually between 100 to 104 degree Fahrenheit, cold clammy skin, goosebumps, fainting, dizziness or weakness, headache, increased sweating, increased thirst, irritability, muscle cramps, nausea and vomiting. It is important to treat heat exhaustion immediately as it can develop into a severe form, that is heat stroke. If the child shows symptoms of heat exhaustion, the parent or caretaker should bring the child to a cool shaded place, preferably in an air conditioned room or vehicle. Encourage the child to drink cool fluids that contain salt, such as ORS, lemon water, and coconut water. Apply a cold wet towel and sponge to the skin. If the child is unable to drink or seems to be losing alertness, contact the nearby pediatrician or children's hospital immediately. The heat stroke is a severe form of heat illness that occurs when child's body creates more heat than it can release. This results in a rapid increase in core body temperature, leading to brain damage or death if not promptly treated. The symptoms and signs of heat stroke are body temperature, which rises dangerously high, above 104 degree Fahrenheit, absence of sweating, weakness, dizziness, confusion, disorientation, flushed hot and dry skin, nausea, vomiting, diarrhea, rapid heartbeat and breathing, severe headache, seizures, and loss of consciousness. Heat stroke in small babies is very dangerous and will present with unusual behaviors or non-specific symptoms such as restlessness, rapid breathing, lethargy, irritability, and vomiting. Heat stroke is a medical emergency. If the child has been outdoors or in any hot environment and shows symptoms of heat stroke, seek emergency medical treatment immediately. Take the following quick actions as soon as possible. Bring the child indoors or into the shade and undress. Begin rapid cooling by immersing the child carefully into a bathtub of cold water. If bathtub is not available, apply cold towels over much of the body, replacing them frequently. Avoid giving oral fluids if the child is unconscious and not alert. How to prevent heat illness? Parents and caretakers can take simple steps to keep children safe from heat exhaustion and heat stroke. Avoid exposure to sunlight during hot timings and encourage them in indoor activities. Ask the children to enjoy outdoor activities during the cooler times of the day, such as early in the morning or later in the evening. Ask them to seek shade as much as possible when outside, especially when taking rest or taking water breaks. Choose clothing that is loose fitting, light colored, and moisture absorbing. Schedule frequent water breaks to cool off and avoid dehydration. Thank you.